Hello, everybody. Good morning, good afternoon, wherever you might be. Welcome to today's webinar brought to you by Corporate Payroll Services. Today's event is how to safely reopen your workplace during COVID-19. We have a phenomenal presentation and presenter for you. We'll get into that here in just a second. We do have a lot of content, so let's go right into some housekeeping items so we can get into that content as quickly as possible. Basic Webinar 101, you will get a copy of the slides and a recorded version of the webinar. Give us about 24 hours to get that to you, but it will be sent to you. We are going to do a couple of polls kind of at the midway point, kind of a halftime show for you, so get excited about those. We'd love to hear from you in those polls. Couple of other things, and Kara, you may want to address this. We have intentionally limited the size of this event so that we can pay attention to Q&A. So if you do have any questions on a variety of topics, and Kara can tell you the topics that are fair game today, but please use the Q&A box for those questions, and we will do our best to pick off a few of those as we move forward through the content. With that, we can go ahead and go into the next slide, and this is our agenda. At this point, I will turn it over to Kara Govro. She is an employment attorney, compliance expert, and has really been dedicating a lot of time to all things COVID safety, and so she's got a great agenda she'll go over with you as we get kicked off with the content. So Kara, welcome, and take it away.
All right. Hi, everybody. It is nice to be here with you today. We are, still in the midst of COVID-19. It's clearly not going anywhere. So there are things we need to continue to think about in the workplace with respect to making it safe and keeping it safe. So our plan today is to talk first about workplace safety. So this will largely be focused on things you need to think about if you're reopening or if you're just sort of starting to make adjustments based on, CDC recommendations or having more people back in the workplace. Maybe you had a really limited set of employees coming in and you're inviting more back now. So what are the things you need to be thinking about? We've got a lot of detailed information in there. Then we'll talk about managing individual health. So quite a bit about screening employees. Then we will talk about what to do when an employee has a diagnosis. And again, we'll be reviewing CDC guidelines there. And then finally, we'll talk about sick leave policies just a little bit and emergency paid sick leave under the Families First Coronavirus Response Act, which almost certainly applies to you, assuming you have fewer than 500 employees. So that is the plan today. Like Josh said, I would love to take questions. Our audience size is good for that today. So feel free to chat in questions using that questions and answers box on anything that I'm covering in this webinar. Or if you want to ask me questions about the Families First Coronavirus Response Act, emergency paid sick leave, and expanded FMLA, definitely open to those questions. If you have questions about furloughs or layoffs, recalling people, I'm open to those questions as well. Really, if you've got a question related to COVID or employment, shoot it my way and I'd be happy to take it. All right, all that said, let's go ahead and get started with making the workplace safe. So really, the number one thing we can do to keep our workplace safe right now is to require employees and customers to wear masks. The science is pretty solid on this, and it's getting more solid every day. This really reduces the risk of infection and transmission between people. This is required in a lot of places as well. Probably more places every day for the foreseeable future will be requiring that people wear masks in indoor spaces. I know that's required in my state. It's also required that you wear a mask in outdoor spaces if you can't achieve 6 feet of physical distance. So first and foremost, follow your area's rules if they exist. We definitely want to at least be meeting the things that are required of us, those obligations. And then what I'm suggesting is that even if you're in an area that does not require masks, they are a really good idea. There's just a bullet there that says if you're requiring masks, you should attempt to provide them or pay for them. Honestly, at this point, most people have their own mask that they probably like better than what their employer might provide. People can certainly wear their own. There are no rules, certainly at least outside of healthcare, that people need to have a certain kind of mask. It could be one of those surgical masks like in that photo. It could be a homemade, single layer cloth mask, whatever works. Obviously not mesh, not lace, and we want to make sure people are covering their nose with it as well as their mouth. If employees don't have masks or you want a particular kind of mask, then yes, you should be providing that or paying for it in some way or another. It's best to have a written policy about this. It just makes everything easier to enforce if it's in writing. And if it's helpful to you, pick a scapegoat. Not everybody is excited about wearing masks. There are plenty of people who, are going to complain incessantly or try to talk you out of it, out of that requirement. So if it's helpful to point at someone else, I say go for it. Say the owner's making us do it, the CDC is making us do it. We have to follow CDC guidelines. If having a scapegoat feels comfortable for you, I'm all in favor of that. Obviously, if you're picking someone within the organization like the CEO, you'd want to make sure they were on board with that, just so it didn't get back to them that they were, having this policy attributed to them when they actually didn't know anything about it. Another extremely important thing we can do is ensure that employees are washing their hands on a regular basis. So have them wash as soon as they come in the door. We don't know where their hands have been prior to entering the building. They have touched the front door and now they're inside. It's time to get those hands clean. I would also suggest scheduling regular hand washing, but consider staggering it, because if we tell everybody to go wash their hands at the top of the hour, we're going to have a pile up at the kitchen sink and the bathroom sinks. So you can stagger that by last name or department, whatever method seems to work for you. Employees will continue to touch their phones, which have been everywhere, as well as their noses and their eyes and everything else. So just because, they washed their hands once when they came in the door and you think it's clean inside the office does not mean that contamination cannot continue from other sources. So that's why, hand washing throughout the day is important. Do provide hand sanitizer, particularly if frequent hand washing is impractical or impossible. So for instance, if you've got people doing deliveries, you're a restaurant, you've got a delivery driver, they are out and about, they are, knocking on doors, touching handles of bags that have been prepared by, the cooks. So make sure they have hand sanitizer so they feel like they can take care of themselves as needed, since they're not going to have access to a sink. And then anywhere somebody can't avoid a touchpad or a frequently touched spot, I would say provide hand sanitizer. So I know that I really, really prefer the grocery stores that have a pump, a hand sanitizer pump right by the touchpad. I can't avoid that touchpad. They can't spray it every single time. So having that available certainly makes me feel better about it and actually changes my choices about which grocery stores to go to. You are probably not a grocery store, but the more opportunities people have to get clean, the better they're going to feel. Somebody chatted in a question about whether you'll get a copy of this presentation. You most certainly will within about 24 hours, so sometime tomorrow or later today. We will send you a full copy of the slide deck as well as the actual presentation in its entirety with the audio and all the rest. So don't feel like you need to take copious notes. These slides have a lot of words on them, and there are some that have even more words than the one we're looking at right now. So don't feel like you need to write it all down. You will have access to this as a reference. We also want to make sure that we are cleaning surfaces on a regular basis, particularly those that are touched on a regular basis. So door handles, microwave buttons, sink handles, the water cooler button if you still have a water cooler. If you don't have a water cooler, or don't have it anymore, then people have started filling their water bottles at the sink. So we want to make sure the sink handle is clean. Make sure that that is somebody's job. Don't just say, oh, hey, you know, people wipe things down after you touch them. Don't count on people to remember that or to spontaneously volunteer to clean things up. Make sure that's actually somebody's job. There's a list of cleaning products that kill this virus. If you search COVID list N, just an open Google search, you will find it. It's a very, very long list of products. I know some cleaning products are still a little bit hard to find, but you'll find some things on that list that might surprise you, like pet cleaners. Well, not cleaners of the pet, but, you know, pet mess cleaners. So there are things on there that might surprise you, that you might have around the house, that might be easier to find on Amazon. I'd also recommend marking high-touch surfaces to bring attention to them. So this is not a CDC guideline. This is all me. What I'm picturing is those little red arrows that you use in documents to tell somebody where to sign. They say, sign here. And, you know, they're just little flags. I think marking high-touch areas with those can be helpful. It brings the employee's attention to the fact that they've just touched something that might be higher risk. So they can disinfect, they can hand wash, they could grab a paper towel first before touching that thing. You certainly don't have to do that, but I do think that's one way to sort of bring attention to those areas. Ideally, we'd also like to actually just reduce touch points. So if there are things that we can replace or install to just make fewer areas where everybody needs to put their grubby paws, that's going to help us out. So if you've got a room that has a door and it doesn't need the door, use a doorstop. You know, maybe you've got a hallway with an extra door in there, or an open office that's just always used as an office or a small conference area, and you know, nobody needs to close the door. We'll use a doorstop. That way people aren't touching that handle. Also, that will probably increase ventilation in that area to have the door open at all times. You can also get motion activated, button activated, or foot pull door openers. I know automating a door could probably be many thousands of dollars. If it wasn't required at some point for ADA accessibility. But very low tech are these little plates that you screw into the bottom of a door so somebody can push down with their foot and pull the door toward them. You don't see, I'm surprised you don't see more of these, but you do occasionally see them in like public restrooms. So very low tech, very inexpensive, very easy. Also, you can look for motion activated garbage cans or just garbage cans that don't have a lid. You know, the viruses, as far as we know, are not like floating off of things in a garbage can. Once they're there on a surface, they're going to stay there. So, you know, an open top garbage can is a really low tech solution to the problem of having to touch the lid of a garbage can to get something in every time. Motion activated water faucets, more complicated. Motion activated soap dispensers, those are pretty easy and inexpensive, just the little standalone ones. You might also want to consider a motion activated or some other kind of automated water fountain or bottle filling station. I think suggesting this, you know, back in February, people would go, wow, that's a really big investment. I don't think I'm going to do that. But, you know, the more we stare down this virus, the more we realize we're going to be here for a while. So now actually is not a terrible time to invest in some of these things. And then also, if you've got a place where somebody needs a pin pad to get into the building, like for security purposes, if you can get that replaced with a key fob, that would be neat. So they can just, you know, swipe a card or whatever to get into the building. The next few slides are pretty detailed and probably not your problem as the listener of this webinar, but they are somebody's problem, probably your building manager's problem. And so you should take an interest to make sure that these things are actually happening. So if you're in an area where your business has been closed for quite some time and you're looking at reopening, there are some things you need to think about. Mold is one of them. And, you know, depending on the part of the country you're in, mold might be not a big deal or it might be a huge problem. So what we want to do is maintain indoor humidity very low, not exceeding 50%. And if we've been shut down for a while, we want to have the building assessed, right? We want somebody to go in and say, is there mold in there? Is it safe for people to come back? And if there is, we need to clean that up before people return. And that could be a very big project. Again, if you're renting, in a building, then this is probably on the building manager. So it's just gonna, be up to tenants to make sure that they're actually doing this. You'd also want to make sure that the HVAC system has been on for 2 to 3 days before you reopen or invite people back. Lots of times when buildings close down, they just turn everything off. Well, we want to get that air flowing. There's also something else called Legionella. It's a type of bacteria that grows in standing water. So if, again, your building has been closed for 3 or 4 months and nobody has been running the water and now you're returning, Legionella is a risk you need to consider. So mitigating this will involve running water, so flushing the system, doing cleaning and maintenance of water sources, water facilities, water features. It's actually pretty detailed. There's like 8 fairly extensive steps for mitigating Legionella. If this could apply to you, by all means, if you just search CDC Legionella, it'll come up. That link is not going to be functional for you, but if searching doesn't work, you could type that in. We also want to be thinking long-term about our building ventilation. So this is something that we're going to change now and keep that way for the foreseeable future. Again, quite possibly not your problem, but something you should be checking into. So the primary goals or suggestions are that we get more outside air and we circulate it more frequently. So if you can open windows or doors, great. If that's not logical, then we want to basically crank up the AC. So we're pulling in as much outside air as possible, up to 100%. Of course, don't do that if the outside air is full of pollutants or you're right next to a construction site and that's going to pull in a bunch of, grit. But in most cases, it's going to be safer to pull in outside air than to circulate inside air. There are other things you can do to improve your HVAC system as well, like installing UV light systems or better filters. Okay, coming back to some things that we can probably more easily do ourselves. And I'm going to cover some stuff that applies to employers who are open to the public, as well to employers who are really just office spaces that don't have people in and out. There's a little bit of something for everyone here. So if you are open to the public, figure out how you're going to stagger customer flow. There's a decent chance that your governor or your mayor has told you that you need to limit capacity to a certain percentage. If you can do that by having people make appointments before they come in, that's fantastic. It might require having people at the entrance and the exit, counting who's going in and out. There are numerous ways to deal with this. You can mark the floor with directional arrows. Do put someone in charge of explaining them or enforcing them, or both, really. People will not automatically look down and follow those rules. I know that was a little hard for for me and my circle to get down the arrows on the grocery grocery store floor. First you have to notice them, and then you have to get over your frustration with having to do like a huge lap around the building to get back to where you wanted to be. But it can be done. We will learn over time, and that will just help reduce people getting too close to one another. Masks, of course, are another thing that we can ask for people to do when they come in the building. I kind of covered that already, but certainly asking your customers or clients to wear a mask is a good idea. If you can set up your pay system so that it's totally touchless, that would be great. I know that some systems you can do this. If you're requiring people to put in a phone number and you really don't absolutely need that, you could rejigger the program so it does not require that. Whatever you can do to reduce touches is suggested. And then do provide hand sanitizer at the door if you've got customers coming in and out. So if you don't have a sink that they can immediately go to, then do have hand sanitizer, because we have no idea what they were touching prior to coming in. They could have, had their fingers up their nose just moments ago. So hand sanitizer is a good idea for people entering our space. As for office spaces, really the best thing we can do is to send people to work from home. I know that's not always possible, but if it is, that's sort of the number one recommendation. Get them out of your building, keep them at home. If that's not doable, then stagger shifts if your production or what you need to do allows for that. Also, if you don't have set schedules, but you want to reduce the number of people in the office, like let's say you've got lots of exempt employees, you could assign hours in a larger working window. So if you're usually open from 8 to 5, you could instead decide that, business hours will be 5 a.m. to 8 p.m. And you could, assign certain employees to come in during earlier hours and certain employees to come in later. Hopefully you can just let those people work from home rather than making them come to work super, super early, but that is an option. Check out your seating arrangements. Make sure people can have at least 6 feet between them and those they're working nearby. Send people to empty desks, empty conference rooms, break rooms, the kitchen, the lobby, the courtyard. It's summer. It's really nice outside in a lot of the country. If your Wi-Fi reaches outdoors, by all means, allow or encourage people to go out there. And if you can't spread people out well enough, your cubicles are just packed a little tighter than that, then do consider installing barriers in open work areas. So, plexiglass barriers. If plexiglass is too expensive or you can't find it, we can go lower tech. There's no reason this can't be low tech. So plywood or even cardboard, construction paper, if you can rig that up to be a barrier, is definitely better than nothing. With respect to meetings, let's figure out how to have them online. This is just a relatively short list of the services that are available for free. So all of these have a free option. Some of them have a limitation on time or a limitation on how many people can show up, but some of them don't. Some of them are pretty wide open. So check those out. If you haven't figured out how to do online meetings yet, you probably have. We've been at this a while now. But I just wanted to give you a quick list there. I'm not suggesting any of these in particular. You'll see that they're in alphabetical order. Just know that there are options out there, and they may be free. So this is not something where you have to invest a lot of money to have an online meeting. If you absolutely have to have a meeting in person, then do the following, all of which is relatively obvious. Hold it in a large, well-ventilated area. Do set up chairs or seating ahead of time. Don't count on people to know what 6 feet looks like or to space themselves out well. Ensure that there are obvious wide pathways, right? We want an in and an out. Preferably, if you've got 2 doors, make one an entrance and one an exit. That way people aren't crossing paths, trying to go in and out of the same door. That's one easy solution, although I know a lot of rooms don't have 2 doors. So make pathways as wide as possible so people don't have to sort of do that little dance to get in and out. And then make sure that you're recording or simulcasting that meeting so that those who can't attend in person will still get the benefits. I think right now we have more people than ever who are getting reasonable accommodations under the Americans with Disabilities Act to either work from home or not attend gatherings like this. And we need to take them into account and make sure that they are, not being sort of held back in their career progress just because they can't attend an in-person meeting. So we need to make sure we're thinking about those people as well. All right, let's talk about managing individual health. So a lot of employers want to know, can we test employees? Can we take their temperature on the way in? You can do a lot of things right now that you couldn't do before. Ideally, though, we're going to have employees self-assess before they come in. We'd rather they didn't come in, with a cough, or we'd rather they didn't come in asymptomatic for that matter. So let's have them self-assess at home. This is the current list of like well accepted symptoms. It's pretty long, and it includes things that look like a cold. So congestion, runny nose, sore throat, headache. If they're feeling any of these things, they should be encouraged to stay home. Likewise, even if they aren't feeling any of those things, but they have a fever, either they feel hot to themselves or they measure over 100.4, definitely have them stay home. And 100.4, that's what the CDC puts out there. But honestly, if somebody tells you they feel really hot and they're not usually hot and their temperature is only 99, I personally would encourage you to have that person stay home. My temperature is usually 97 something. So if I were to have a temperature of 99 or 99.4, that would be hot for me. That would be a fever by my own personal standards. So don't feel like you have to bring people in just because they're under 100.4. You can pass on these best practices to employees who are taking their temperature at home before coming in. They should wait at least 30 minutes after eating, drinking, or exercising. I think that probably doesn't apply to drinking water. Wait at least 4 hours after taking a fever reducer. So obviously, if they're taking a fever reducer for a fever, we don't want them coming in. But if they're taking ibuprofen for sore muscles, then we still want them to wait 4 hours after their last dose to take their temperature. If you're taking temperatures, here are the general guidelines you should follow. So a lot of employers have asked about this, and the CDC had not made these rules and provided them to employers. Where I found them was buried on a page about group housing. So like homeless shelters and checking people on their way in. And this is the guidance they provided for group housing for the person who's in charge of taking temperatures. So I don't know why they haven't spread this around and put it on other pages, but it is out there, and this is what they suggest. It's pretty straightforward. So make sure both parties are wearing a mask when you do the temperature taking, or the asking about symptoms. Make sure there's as much distance as possible here. So we at least want the forehead gun. If we can get a forehead gun that takes the temperature from a few inches away, even better. And make sure people who are standing in line to get in the door are observing physical distancing. If you have gloves or they want gloves, do make those available. But frequent hand washing is really important too. A lot of people don't really understand how to use gloves or don't realize that gloves don't do much because you're still passing the germs around on top of the gloves. So don't rely on gloves exclusively. Do make sure that people involved can wash their hands on a regular basis. Make sure you're sanitizing the thermometer between uses. We obviously don't want to be using some kind of tongue thermometer situation. If you want to buy the disposable kinds, have people, do it to themselves, read it out to you or show it to you. That could potentially work as well. But I do think the forehead thermometers are pretty easy to get right now. That said, about forehead thermometers, I do think there are absolutely variations in quality, and that they need to be used in the way you're instructed to use them. So if it's a thermometer where you need to touch the forehead, doing it from 2 inches away is not going to work. I know that my gym had a thermometer at a forehead thermometer at the front door, and every single person's readout was like below 98, which is just really unlikely, especially since the weather has been warm. So if you're going to rely on a temperature taking device, make sure it's good. Otherwise, it could be leading you very astray. You can also ask employees about symptoms. You can have them self-assess at home, and then if you want to ask again when they get there, which might be required by law, depending on what you do and what state you're in, then that's fine. Make sure you're keeping it specific to COVID-19, though. We don't want to ask open-ended questions or ask about people's mental health. That's none of our business in this situation. The fact that we can ask it all is only because this is a global pandemic and we recognize that there's a direct threat to others in the workplace. So usually the ADA would not allow you to, interrogate employees about their temperature or their symptoms when they come in the morning. But since we're under pretty special circumstances, those rules are different right now. If you've got employees who are just generally anxious about coming in, that's understandable. That's one of the #1 questions we're answering. Do explain to them what you're doing to keep the workplace safe, particularly if you haven't called them back yet. Like maybe they're on a furlough, you're just about to start calling more people back. Send an email, or paper letter or whatever it is. Make an announcement about all the things you're doing to keep the workplace safe. Put their mind at ease ahead of time. If people want to wear extra personal protective equipment, just let them do it. If they want to wear a mask and a face shield and gloves, just let them. It's fine. If that's what they need to feel okay about coming to work, just roll with it. All that said, being just generally anxious or fearful about coming to work is not a sufficient reason to turn work down. And for instance, stay on unemployment insurance. That was, that's a continuing question. People who have been, furloughed are out there getting UI, and UI pays reasonably well right now, better than ever actually. And so they're saying, I don't want to come back, I'm afraid. Well, just being afraid is not a good enough reason to turn down work. That said, probably quite a few people will be entitled to a reasonable accommodation under the ADA right now. So if someone has something that makes them particularly high risk for COVID-19 or a bad case of it, then they bring that to your attention, you need to engage in the interactive process. If you've reached that point where they say, I need special treatment because, let's say I have heart disease and a history of lung conditions, then you can ask them for a doctor's note to support that. That's part of the interactive process. Most things are going to be considered pretty reasonable under the circumstances because most of them aren't going to cost you that much or be that difficult. What we're probably going to do is call that employee back to work last if we've got a bunch of people furloughed. We're going to provide them unpaid leave. You're not required to give them paid leave, at least not once they've used up anything provided under the FFCRA. We're going to allow people to work from home. Maybe you don't like people working from home, but if that's what they need to do because of their disability and their doctor says so, if they are capable of doing that, if their work can get done from home, you're going to let them do it even if you don't like it, even if you don't believe in working from home. That is going to be a reasonable accommodation. Again, this is, office environments. Obviously our waiters and waitresses cannot work from home. That's not going to be a reasonable accommodation, but for them, providing an unpaid leave may be a reasonable accommodation. And again, if these people want to wear, additional PPE, or they need extra time to feel extra clean, that's going to be reasonable as well. It doesn't cost you a lot of money and it's not hard. My last note on this slide is that you don't need to accommodate people who have a vulnerable family member, but I think you should. So, if you've got a worker and they could potentially work from home and they've got a wife who's on chemotherapy, she's immunocompromised, you don't technically have to let that person work from home. Because the ADA doesn't extend 1 degree out, right? It's only if the worker has a disability, not if they live with someone who has a disability or have a family member with a disability. That said, you don't want that wife's death sort of like hanging over your head if you're forcing that person to come to work when they could have worked from home. So I would strongly encourage you to accommodate those who have vulnerable family members. All right, I'm going to turn it over to Josh now for a couple of polls, and then we'll be back.
All right, thank you, Kara. I'm going to launch the first poll here. The question is, how confident are you that you will meet workplace health and safety expectations through COVID-19? These expectations can be from anywhere, whether it's agency guidance, whether it's your employees' expectations, your own expectations. Just in general, how are you feeling about kind of this new set of standards before us and meeting those expectations. So I will let this go for just a little bit. I hope you're all seeing it on your screen. Looks like we're at about 40% here. So we'll let this go another 5 or 10 seconds. I'll take this as an opportunity just to remind you, we will be sending out the slides in the recording. Give us about 24 hours on that. But let's see, we're at 60%. I'm going to go ahead and close this out. So we'll end that poll and I'll share these results here. So good thing, looks like very confident is a clear leader, about 50%, somewhat confident being second there, and then not very confident. So, you know, our hope here is that wherever you come in on this scale, that this type of event, this type of information can put you in a better place. So we certainly hope that it is useful for you. So I'm going to pull that one down. Let me go to the second one, and then we will get back to Kara. Okay. Question here is, to what degree is HR responsible for workplace health and safety practices at your organization? And fully knowing that based on your size of organization, you may not have formal HR internally, but I guess the question is, to what degree is the person or people that wear the HR hat also responsible for health and safety at your organization? So we're already at 30% there. We'll give it a few more seconds. And just so you know, we haven't seen a lot of questions come in, but we do have a great audience size here to be able to address your questions. So use that Q&A box when you have those questions. Okay, we are at 60%. Let me end this, and I'll share these results as well. It looks like the first place leader is HR is mostly responsible. So it looks like there are other role players involved in health and safety practices at most of your organizations, followed by HR is fully responsible. And then down, the smallest one is HR is not responsible at all. So interesting feedback there. It's kind of neat to see across different businesses, industries, business sizes, how these roles pan out within various organizations. So I will pull that down, and with that, we will get right back to Kara for the back half of this webinar.
Alrighty. Somebody did send in a question that said, can you speak to balancing state and local regulations versus employee and customer expectations? And I would love for you to elaborate on that if you can, because just based on what you asked, my response is that we have to do what the state wants us to do and what, you know, local regulations say we need to do. So, you know, those should be treated as laws because they are, so we need to follow them. And then, you know, as far as what your employees and your customers expect, we can't go below the bar of what the state and the locality require of us. We certainly can go above and beyond. I've, you know, before masks were required indoors where I live, there were places that were providing, you know, just cheap surgical masks at the door saying, you know, we require that you wear a mask. Here's a surgical mask. I mean, that's one thing you can do. That was their requirement. It wasn't a state or a local requirement, but they were helping people meet it by providing the mask. You know, I was mentioning that, you know, some of the stores I go to have hand sanitizer at the, you know, at the checkout. So now that you're done in the store, you can clean yourself up and feel good before you even leave. So that, as for a customer, that's important to me. And I am making my choices about where to shop based on things like that. So there are things you can do to help your customers meet what you need them to do. There are things that you can do to encourage customers to select you over, you know, others. And certainly for your employees, like I said, you know, if they want to do more, by all means, let them do more. There are some people out there who think masks are really stupid. They're not into it. They think this is a hoax. But more people are actually pretty afraid of this. So the things that you can do to help them feel good about being at work or being in your workplace, you know, I think more is better. I think erring on the side of more protection is ultimately going to benefit us. And if you are going to require more than you know, asked for by the state or the locality, then by all means, you know, explain why you're doing that, and if necessary, say that it all rolls up to, you know, the CEO, or whoever it is that's making those rules, or is willing to be your scapegoat, as you mentioned in your follow-up there. All right, let's talk about dealing with a COVID-19 diagnosis. So when we know somebody has COVID-19, or we're pretty darn sure because their health care provider thinks they've got it, when will this person be able to come back to work? So there are different methods for determining when someone is, you know, quote unquote safe. So there's a time-based method, a symptom-based method, and a test-based method. You can learn about those on the CDC website. A lot of employers really want employees to get tests, and the test-based method does involve having 2 negative COVID-19 tests before returning to the public, you know, or to work. But a lot of people are not going to be run through the test process. They're going to, you know, their healthcare provider is either going to use the symptom-based approach or the time-based approach. So I would say work with your employees and don't expect that they're necessarily going to be able to do the testing approach. If their healthcare provider thinks that, you know, the symptom approach or the time-based approach makes sense, and that's what's available, then I would suggest you go with that instead of trying to force their healthcare provider into something else. Also, tests are getting harder to find. That's another thing employers are doing right now, is they're wanting to have people tested, you know, before they come back to work from a furlough. And while that's nice in theory, there are a lot of places where an employee isn't going to be able to get a test if they're asymptomatic. So that's not as feasible as a lot of employers are imagining it to be. Anyhow, if we know somebody is sick and their healthcare provider is using the time-based or the symptom-based approach, this is what you can probably expect. Their provider is going to say that 72 hours after they have recovered, meaning they don't have a fever, and they haven't been using fever-reducing medications, and their other symptoms have improved, as well as 10 days having passed since symptoms first appeared. So that can be a little hard to wrap your head around. But basically, if you've got someone who came to work, had some mild symptoms, you sent them home, which is good on your part, they go get a COVID test, or they talk to their healthcare provider, and their healthcare provider says, yeah, that sounds like it could be COVID, you should probably stay home. But then they feel better, right? They feel better the next day. We're not going to have that person come back in 3 days because their symptoms resolved. We're going to have them come back in 10 days because we need to get 10 days from the time the symptoms first started. Somebody asked, can we use symptom-based testing for some and test others as circumstances allow, like what the doctor says and whether testing is available, or we need to have one policy and apply it to everyone? You can definitely do different things here. And again, I think it's really going to rely on their provider. You know, if they go to, you know, a hospital that has testing readily available, and you know, their healthcare provider is in that hospital and says, you know, go next door, get the test, we're going to do the testing plan, that's fine for that employee. If someone else doesn't have health insurance, they've gone to the local clinic says, yes, that sounds like COVID-19, you know, but we, you know, the drive-in testing has a 7-day waiting period and it costs $250 for a test, then yes, using time-based or symptom-based for that person is acceptable. I would be careful about requiring testing for people who don't have access to testing, right? So you as the employer should not decide like, oh, well, your symptoms seem a little worse, so we're going to require a test from you. While that might not ultimately result in a lawsuit that you lose, I don't like it because it does put a financial burden on the employee, or potentially a financial burden. I know that health insurance providers are supposed to be covering this, but not everyone has health insurance. So I think testing, I wouldn't select testing for someone if their doctor hasn't selected testing for them. I think that's sort of above our pay grade as HR practitioners. But certainly if someone's doctor is testing them and someone else's doctor isn't, you don't need to sort of enforce that everyone use the same system. That's a really good question. What do we tell other employees? Once we know that somebody in the building has been sick. So you do want to notify other employees who've had potential exposure, but you don't tell them who's sick. And that will upset some of them. They will want to know exactly who's sick so they can assess their own risk on their own, by their own standards. But the ADA does not allow that. We cannot share that medical information with other people. If they figure it out on their own, that's fine. If you're a 10-person office and one person is missing, and you need to tell people that, someone has COVID-19, they're going to figure it out. It's fine. It's not your job to maintain the secret. You're just not going to share that information yourself. If someone was in the workplace, you've got a huge workplace and, someone is in one corner of it and they don't go to the other corner of it, you are certainly, I think, okay to sort of let people know that, if you work on the East End, we think your exposure is nil. If you work on the West End, then your exposure was more significant. The other thing you can do here, which I would encourage, is to call your local health department. If somebody has been diagnosed at work, you can call your local health department, explain the whole situation, tell them about your setup, and they can give you some guidance about, the level of risk your employees have and what next steps you should take. I would strongly encourage sort of reaching out here. We do have experts for this. Will exposed employees need to quarantine? Yes, if there was close contact for a prolonged period of time. Unfortunately, these terms are not well defined. The CDC says they don't have enough data yet to say what these things are. So it's a little bit of a subjective measure. More than 15 minutes at less than 6 feet is going to be close contact for a prolonged period, even if masks are in play. We do think masks are valuable. That's not contrary. That's not saying masks don't work. It's just the CDC is saying, if you're that close for that long, that is going to require a quarantine. However, don't get too hung up on either of these. If you know somebody came in with COVID-19 and, they sneezed in someone else's face, we don't necessarily need a prolonged period of time to say that that other person should quarantine. One of the questions we're getting a lot right now is, what do I do with employees who engage in high-risk behavior? Like, I know that they went to a huge gathering without social distancing, or they traveled to Florida, even though we didn't want them to travel to Florida, and now they're back. Certainly, as an employer, you have the right to sort of enforce quarantines on people if they do things you don't like. I'd be careful with it. We need to be really non-discriminatory with things like that. But I wanted to provide this reference point just so you have some sense of risk mitigation. So in critical infrastructure environments, so this is like healthcare or, people who work on the power lines, or the dams, things that we literally need to not fall apart during a pandemic, that's critical infrastructure. And not all of those people can just go home and stay home because they've been exposed. So here's the protocol for those people. We're going to pre-screen them before they come into work in the morning. We're going to make sure that they're self-monitoring, and we're going to follow up with them to make sure they're doing that. We're going to have them wear a mask at all times. We're going to have them social distance at all times. And we are going to take extra efforts to disinfect and clean workspaces. So, if you think, your employees are going to feel like, oh, I had exposure, maybe I should stay home for 14 days, I don't want to come back. But realistically, if we're following these steps, we feel like the risk of transmission is pretty low, even in some cases where we know somebody has been exposed. So just a sense. I don't want you to feel like, oh, someone was diagnosed, I'm going to make them come to work and follow these steps. That's not what I'm suggesting. I just want you to get a feeling for, what you can do with employees who you might think are taking risks that you're not comfortable with. And realistically, these are things that I would recommend you be having all employees do all of the time. If you find out that someone was diagnosed, do you need to disinfect or close the work site? Uh, Probably not. Ideally, the CDC would like you to close the area they were in for 24 hours. We seem to believe right now that most of the bug is mostly dead after 24 hours. So risk will be very low that it's lingering after that amount of time. Realistically, you may not be able to close the area for 24 hours. If you're open for business or whatever to outside customers. So close it as long as you can. And then undergo recommended cleaning and disinfection. Again, you're going to get a copy of this deck, so don't feel like you need to take copious notes on this, and I will not read it all to you. But really, there's just pretty basic cleaning and disinfecting that's recommended if somebody's sick has been in your workplace or your workspace. If someone is sick, but they haven't been there for at least 7 days, then we don't need to worry about doing any additional cleaning or disinfecting at all. We're quite certain that it's all dead after 7 days. There are some very specific recommendations for vacuuming, though. So if someone, who's mildly symptomatic has been sitting in the office, all day, breathing without a mask, and, your cleaning crew is coming in to vacuum that night, you should put them on notice that somebody sick was in that area, because we don't want them blowing the germs around and getting themselves sick. So there's really specific guidance on vacuuming. And if you, thankfully the CDC website is pretty good. I think it's pretty great, actually. So if you Googled like COVID CDC vacuuming, you would land on those instructions. Okay, let's talk about sick leave policies now. We are wrapping up. So if you have questions, by all means, send them my way, and I will get there shortly. So sick leave policies, I'm going to cover pretty quickly. My suggestion is that you make your sick leave policy as standard and well enforced as your attendance policy. And by this, I mean you are encouraging employees to use your sick leave policy. We want them to stay home when they are sick. We don't want people to be heroes, and we don't want them worrying about losing out on a little money. So we are going to have a paid sick leave policy. And we're going to change our attitude toward absences. So a lot of organizations, corporate is like, oh yeah, we encourage people to stay home when they're sick. But the managers are not on board. Managers are making people come in when they're not well because they have deadlines to meet. So we want to make sure that our mindset is shared by our managers, and that might involve punishing managers who allow people to come in when they're sick. We may need to take a draconian approach to this. If you have attendance incentives, I'd get rid of them now. We don't want to be incentivizing people to come in when they're ill. And also make sure that your call out policy is reasonable. So if you've got, for instance, a policy that says we need 24 hours if you're going to be out sick, which I have seen multiple times, that doesn't make a lot of sense, because that's not how sickness works. And then that person is going to drag themselves into the office symptomatic, because they don't want to violate that policy. So make sure people aren't going to bring germs to the workplace just to avoid a policy violation. If you are in a location that has mandatory paid sick leave at the state or the local level, it almost certainly covers COVID-19. If a person's sick, it definitely does. And it may have been expanded, kind of like the FFCRA, to allow people to take care of other sick individuals as well. So do check out that if you're in a state or a city with sick leave, they may have updated it. I've mentioned emergency paid sick leave under the FFCRA a couple of times now. This is basically national paid sick leave. So it applies to all private employers with fewer than 500 employees. There is no exception for small employers. It's available to all employees, even if they started work yesterday. The good news is that you don't have to pay for it. You do sort of like pay for it out of pocket up front, but when you get your payroll tax bill or you go to pay it, you get to take the amount you spent on EPSL right off the top of that payroll tax bill. So this is funded by the federal government. It's not coming out of your pocket, so you have no incentive to try and prevent employees from using it. This does need to be offered in addition to anything else you already offered. So if you already offered 5 paid days of sick leave, this is right on top of that. This is available when an employee is unable to work or telework for any of the reasons listed below. It provides full-time employees with up to 80 hours of paid time off. Part-time employees will get the number of hours they work, usually in a 2-week period. If they work a variable number of hours, there are calculations that you can find on the DOL's website that will tell you exactly how to figure out how many hours they'd be entitled to. Leave can be taken more than once. That's been a point of confusion for employers. Because you're not supposed to take it intermittently if you're sick and coming into the office. Employers kind of latched onto this idea of like no intermittent sick leave, but it's very specific to like if you are coming into the office, we need you to not bop in and out while sick. However, if you want to use your first 40 hours of EPSL to take care of grandma, which is an allowed use, and then 3 months from now you get sick yourself and you want to use your other 40 hours to take care of yourself, that's allowable. We can't split it like that. When employees are using EPSL, the documentation we can require is fairly limited. We have a form for you to use. It fits on 1 page, so it covers their name, the dates they want leave, the reason they need leave, a statement that they are unable to work because of this. And then a little additional information is required depending on why they're taking leave. So very limited things we can ask for. And we do have that document for you in the HR Support Center. I would encourage you to do more though. Have a policy that allows time off for any illness, not just COVID-19, not just those serious symptoms or cold-like symptoms, but make sure people know that you want them to stay home when they're not well. Even if they don't have COVID-19, whatever they do have is, making their immune system work overtime. It's quite possibly contagious. We don't need to spread that around, particularly in the middle of a pandemic. All right, I'm going to turn this over to Josh for just a minute to talk about some resources, and then I'm going to come back for any last questions. And I do see at least one. If anybody else has any they want to throw in, go for it now.
Cool. Thank you, Kara. Just wanted to take a brief minute. We'll keep this quick, but just to remind you of some resources that Corporate Payroll has for you in the HR Support Center. I'll highlight a couple here. This is our Return to Work checklist. This has been one of those resources we continue to receive great feedback on. It provides a framework for those who are thinking about or in the middle of reopening your business. A lot of considerations there. So we hope you get a chance to check out this Return to Work checklist. Another piece that Kara is all too familiar with is a quick start guide deciding who to recall from furlough or layoff. A lot of sticky considerations there, and so we've got a great guide here. If you need to know how to access the HR Support Center, please reach out to your corporate payroll representative, and they will be happy to help you there. And then we've also got other elements that we can offer in terms of providing more situational expertise. We know we look at the questions that are coming in today, and of course we try to respond to as many of these questions as possible in a webinar format like today, but we all too often there are just situations that need the dedication, of an expert to look into a specific situation. We have resources to help you there if you find yourself in that situation, with access to live advisors. If you have questions about that, please, again, reach out to your corporate payroll representative. With that, we've got a couple minutes left. Kara, I'll let you address some of these questions.
All right. There was one last question that came in. Someone asked that I elaborate on an employee's risky behavior if they are not an essential worker. So it's complicated because there are really no rules and no laws other than, don't be discriminatory in how you respond to these people. So we're getting calls about, for instance, somebody traveled to Florida and, we didn't want them to travel because travel seems dangerous and Florida is a hot spot. What do we do with that person now? So we've actually been working on answers specifically to the travel question just in the last few days because it started cropping up a lot, particularly with certain states enforcing like travel quarantines. So as an employer, even if you're in a state without a travel quarantine, you could make that your policy if you want. I would strongly suggest making it a written policy that employees are told about ahead of time. People don't like being surprised with a quarantine and being told that they're out of work and out of pay for 2 weeks all of a sudden. But you can make policies that say, if we discover that you are out there in the world without a mask at large social gatherings, or we discover you're traveling, or you've gone to a COVID party, or you're hanging out in bars, you as an employer can take a stance that that is creating substantial risk in the workplace and that you're going to, take action. Maybe it's enforcing a quarantine on that person and telling them they can't come back to work. Maybe it's telling them to work from home. You can take different approaches to this, but you need to be consistent. The catch with all of these is that because you're telling employees that you're going to take this recourse, they're incentivized to lie to you about what they're doing. So sometimes we've got employees tattling on other employees. They saw their Facebook pictures. They know they were at a big party. But other times we know employees are doing risky things that we're not hearing about. Or since they know we're going to take action, they're going to do their very best to make sure we don't hear about it. So that's where it kind of comes back to just take all of the precautions all the time, because we will find out about the employee. Maybe we'll find out about the employee that travels to Florida, and maybe someone will rat out the employee who was at a big party with no social distancing and no masks. But we may have another dozen employees who are doing those things and we don't know about it. So that's where distancing, masks, hand washing, cleaning and disinfecting, it really comes back to that. If you want to make a policy about travel or risky behavior, you can do that. You want to be consistent with it, but because it's not perfect, because we're not going to know about all the risky behavior, it's best to just go ahead and sort of be over the top with well, it's not really over the top, it's being reasonable, but it may feel over the top about your safety measures. All right, thank you all so much for hanging in. It was great to be here with you today, and we'll send you a copy of all of this relatively soon. Thanks a lot.